on the spread of infection down in the child care center. But then also, what are the teachers doing with the children? A center is as good as the people that are working in it.
Child care workers are among the lowest paid workers in our country, and yet they take care of our most precious resource. That has to be an issue that we address in the 90s.
It's fairly accepted that it's a minimum wage type job, and it's very hard for facilities to keep staff. There's a very high turnover, 53% turnover in daycare staff annually. It's very difficult for these private businesses to offer the enhancements that will keep staff, and they are struggling to professionalize the industry, but they have a way to go.
Daycare centers in Georgia care for well over 100,000 children a year. They are licensed and routinely inspected annually. All new facilities are inspected and licensed prior to opening. Many other businesses are much more closely monitored than daycare. Grocery stores, for example, are inspected every 4 months.
In terms of regulation, I would really like to encourage parents to become very involved. A lot of parents believe that because the center has a license, that means it's a good housekeeping seal of approval, that the center is wonderful and good. That's not always the case, and it certainly does not mean that. All it means that for a certain capsule of time when the state was in this center once a year, we wrote up a report the way we saw it once a year. The parent is in the center twice a day, and they have a great responsibility in terms of monitoring the care their child receives.
I wanted to feel comfortable that he's with people that really care about him and that tell me at the end of the day when he's had a bad day, or I can tell them when I come in the morning that he's had some problems at home or he hasn't felt well or things have happened, that he may be upset, and they care about that.
The accreditation through the National Academy of the Early Childhood Education is the only measuring stick for quality that we have, and it's been around for about 5 years. And one of the things that I'm most proud of at Sheltering Arms is that we were among the first in the state of Georgia to become nationally accredited. This allows parents to be more assured that they're leaving their children in a program that meets standards that far exceed the minimal standards required by our state.
The daycare regulations were revised and became effective last March to strengthen them, particularly in the areas of staff training requirements and ratio requirements. We enhanced the nutrition requirements for children by adopting the USDA guidelines. So they are stronger than they were. They, however, do not meet the national average in terms of staff-child ratio, but they were improved in that area.
Nationally, the recommended child-staff ratio for infants is 1 to 4. Interesting to note that in 1925, it was 1 to 8. Until this year, Georgia's ratio was 1 to 7, when it dropped to 1 to 6. 1 adult to care for 6 infants, still way below the national standard.
When you think of what has to be done for a child of that age, they have to be fed, they have to be changed. You know, how much time does this leave to really interact with each individual child, to see that they're not left in cribs or pens, but are out exploring their environment? You know, it's kind of scary. And I think that's one of the reasons so many parents like family daycare for their infants and toddlers, because it's a smaller group and there's a little better child-staff ratio.
Family daycare providers are required to register with the state and undergo a criminal background check. Even though this is the most widely used form of child care, the regulations are minimal. Family daycare is not monitored, and providers are inspected only if a complaint is registered with the state.
Right now, there's approximately, and the figure fluctuates constantly, but there's approximately 5,000 registered family daycare providers, and there's probably twice that many that are not registered. And that should be addressed. and we should be pushing to get everyone registered. And that's what the Georgia Association, Save the Children, and the Resource Room is doing, trying to help to get those people registered.
Family daycare is virtually invisible to the regulatory agency. It's a very informal type of care in a neighborhood, and many women will start caring for 1 or 2 children, and then that will just broaden to more, and they're not aware of the need to register.
I think the main issue in Georgia, we would like to see, the Georgia Association would like to see family daycare monitored. We are not monitored now by the state. Most of the registered providers are on the food program, the USDA food program, and we are monitored 3 times a year by our food program coordinators. And they do use the DHR checklist as a monitoring tool, but we would like to see the state do the monitoring. Second of all, we would like to see some increased requirements, such as training and, like I said, CPR.
The issue of family daycare regulation is one we've struggled with in this state for the past several years. The issue is a budgetary one. With that many facilities out there, it takes a lot of state dollars to regulate them. We estimated well over $1 million, and with the current state budget situation, it's fairly unlikely that that much additional state money will be added. It's not just in Georgia, other states are struggling with the same thing. It really all depends on how the budget situation works out. I understand and appreciate the fact that the providers want to be monitored, but it's just something we're not able to resolve right now.
I think parents need to be educated. They really have a lot of control and they don't even know it. I think parents need to be aware of what they can do to improve child care. There are 13 adults that come into my home every day, and they certainly see what's going on, and they're going into all the centers and all the other homes. And I think educated parents would be a real good way of improving child care.
Obviously, if we're going to seriously address in a comprehensive way the child care needs of our state, we need a very broad-based approach to that. For example, if we're talking about school-age children, it appears to me that the public would be much better served if we would build on our public school system for pre- and after-school care. I'm not trying to tell the educators how they should do their business, but we as a citizenry ought to use those resources and build around that to assure accessible, affordable, quality care for school-aged children.
There is a tremendous need for places for children to be after school. And I think, again, as a society, we have not made that commitment to our children. We're pretending that they're going home to mom for cookies and milk, and that no longer is happening. They're going home to empty homes. They're going home to programs that, unfortunately, are understaffed and underfunded, or they're in the streets.
It's going to be the playground. It's going to be the pusher. It's going to be something that utilizes this person inappropriately. It's going to be the child molester. It's going to be somebody that does not provide for them in the way that they need.
One of the things I think communities can do is to develop a plan for what kind of after-school activities are there and what are needed.
The Oakhurst project started in one of the schools that had the largest percentage of transiency and the greatest number of children who had the greatest need. At risk is the popular term right now. We were trying to find ways to provide for these children educationally.
When we sat down and said, these are some things we feel that our students need, we feel that they need additional medical care, we feel that they need homework help at school, they need extra tutoring, because many times they had moved from place to place. The parents said, our biggest concern is after school care. And the reason our biggest concern is after school care is because a lot of us are single parents, a lot of us have to work, we don't make enough money to pay the regular cost of daycare, but our children, when we're at work and they're not at school, we're worried about them. So we want to make our #1 priority a latchkey program.
School-based programs like the Oakhurst Project, or even other than the Oakhurst Project, that serve middle-income children are real important. We find that there's a need in our community. When we started our after-school program 10 years ago, there was one daycare center that offered after-school care, and so there was not an alternative for children in our community. A lot of middle-income families are single parents. They have 2 parents working. They're struggling to make ends meet, and so after-school care is not just an issue for poor children, although that adds another dimension. It's an issue for all parents.
There are enough children that need after-school care that those that choose private agency could easily fill those up, and those that can't afford it would have an option. Right now, the way the system is set up is those that can afford it have the option, and those that can't afford it are children that are not really getting the best that our country can provide for them, or that I think they should provide for them, because children are our future. And if we just cast them aside, then they grow up thinking that they're worthless.
Watching the kids that we had the first year that we were in the Oakhurst school, and seeing those same kids that we have, you know, that have gone through the 3 years, we've made a difference. And the kids they're happier, they're a little more self-assured. We've made a difference.
It makes me feel real good when I see children smile and you see that light in their eyes. Then it's worth it. It's worth it.
After school and summer care poses a particular problem for parents with special needs children. Finding child care, period, for a special needs child, parents find their options limited.
When it comes to daycare, frankly, there haven't been a lot of places for them to even choose to pursue or to have as an option. It's interesting, we started the concept of special care over 2 years ago, primarily because we kept hearing these cries of help from the parents.
Up until this year, there was no daycare for special needs children. I've looked for 12 years, and there's just nothing out there.
We have friends with normal kids. They have a tough time finding daycare. When we first had Katie diagnosed, we thought, well, we'll put Katie in some regular daycare, and we went to a place that has one of the best reputations in this state. And they said, sure, no problem, we can handle Katie. She's not medically fragile, she's just developmentally delayed. And what they ended up doing was putting Katie in a beanbag in the corner, which is not what she needs. She needs constant stimulation, constant working. Shh, Daddy is speaking, Daddy is speaking. And it was very, very difficult for us to accept that. And this was the only place that would accept Katie. Every place else we looked at just said, no, absolutely not.
I think that one of the driving forces behind the daycare aspect of our business was the fact that a lot of facilities say that they will take a child, but frequently are not really ready or capable of really meeting their needs, their true needs.
I was told when she was about 4 that if she wasn't sitting up by the time she was 4, she wouldn't sit up. Well, that didn't come to pass, and you know, she never ceases to amaze me. I never know what she's going to do next. And you know, folks say, well, isn't it really hard for you? Well, it's not me, it's her.
A lot of us are trying to help these families, and if we all just kind of pool our resources and pool our efforts, I think we'll get a lot more done, and we'll be able to collaborate together instead of kind of fighting for territory. I think we'll find that even public and private sector can work together and really make some gains in serving the families.
Georgia has been struggling with taking care of its children for years. People have been concerned and have been working on the issues, but not in unity. There has never been one central office to deal specifically with these issues. They've been handled through various state departments, creating confusion and barriers for child care providers and families.
The procedure is totally ridiculous. especially when they basically opened up the child care and especially the subsidized child care industry in terms of being competitive and really marketing it like any other type of business and saying, you know, we want our parents that are subsidized to be able to go choose child care anywhere. Well, you're telling the parent, you know, you can go choose child care anywhere, but when the parent chooses the child care, you're saying, well, you can't go get that child care right now. You got to wait until I check with 100 other people on the list. And it's really unfair to the parent. It's unfair to the provider that's trying to offer the service.
There are services there in multiple ways, but they don't know how to access them. And caseworkers are often falling over other caseworkers and not even communicating with the needs of the children.
Putting the pieces together is our job. We have not done it because all of the congressional laws are specific. For example, if you're getting food stamps and cash, you go to the same office, but you have to have 2 different kinds of applications. And if you own an automobile, it is counted 2 different ways for cash or for medical assistance or for food stamps. And that is insane.
Recently, the Georgia legislature took a positive step toward a more unified approach on a state level by establishing a state child care council.
If we have that council that brings together the providers of service, the government people, you know, business and corporate people, you know, we can take a better look at what's, you know, what is out there, you know, what's lacking, and maybe come and find some solutions.
Other levels of government are examining the situation and seeking solutions.
Now, we're also working on, with the Fulton County Roundtable on Children, which is an initiative of mine, given full support by the entire Board of Commissioners, we're working on thinking through how to work with the city on a child development staff person for the government. And that it is my notion that that person would provide technical expertise in child care and child development issues to every child care entity throughout Fulton County, public or private.
Child care, to be affordable, accessible, and quality, is going to take people working together who've not always worked together. Child care providers, governmental agencies, the families themselves who receive the child care. The Atlanta Housing Authority needs to get more and more involved. The city school board does some wonderful things with after-school programs. All these people have got to talk to each other, and one of the functions of this office will be bringing the people together to form the partnerships. The other thing they've got to do is to work very closely with business to figure out what the incentives should be for business to provide child care for their employees. What are the stumbling blocks? We know of some zoning ones.
In fact, we learned there were 2 or 3 major corporations who had tried to set up a daycare centers, but because of the zoning laws, as President Drone, they weren't able to do so. So we got young lawyers to look at those particular laws. We found out that the state did not have laws in many instances dealing with some of the issues. And what was good about it was having people who work in child care there who could talk about the problems and the issues they had encountered over the last 20 years. It was almost like government, unintentionally, was working against the welfare of children. And so we said, this cannot happen.
Combined efforts are underway from many sources to help find solutions and address the needs.
The program here at the Parish House is one of 4. Right now, we have just replicated the program in 2 additional communities, and we actually started another community at Kings Memorial United Methodist Church. Again, the ingredients are, we think it's real important to have a child care specialist who goes into the home, works with the provider, brings toys, books, and equipment, helps support her in her role. One of the things that the Neighborhood Child Care Network does is mobilize community resources and bring people together to look at unmet child care needs.
We are one of the 14 pilot programs in the state with the governor's initiative to work on this specific point of collaborating with other agencies, Department of Health, Department of Family Children Services, Corrections, the MRESA, Georgia Powers, representative of private business, are all working together to see how industry, business, agencies can better serve individual children.
And what we hope to be is a catalyst or an influence to bring people together in a way that perhaps they haven't come together before, to really create some kind of collaborative services that will benefit children. We really see one of our strong missions in heightening the awareness of the corporate world, that there's a real responsibility for that age children. I think over the past several years, businesses have become much more aware that we really need their help in order to make the future better for all of us. I think what we want to do is help them to see that we really need their help even at that level.
I think corporate America, when it gets involved in child care, has a record of doing the very best child care. And I think they can be very proud of themselves. They understand the link between quality and what their employees get out of child care.
Corporate America has to do something to be responsive to the needs of the workforce. And in a case such as child care, this is something that we can do, providing that alternative for employees to take their children close to the workplace so they could visit, they could have lunch with them and watch their development and growth during the first few years.
We can tell just from all the things that she's been exposed to that she's very curious and she wants to learn, and she wants to come home and read books. So it's just made a big difference in her life. And we're very happy that she's been able to be exposed to so many different children, so many different stimulating things here at daycare.
The more corporate sponsors we have in the child care field, the better overall quality in the community. Our center has impacted centers around us. We've been able to keep our quality high, and we've seen centers in the same vicinity go up in their rates and go up in their quality for teachers and pay for teachers. And I think that the corporate influence will very positively impact the early childhood field.
Sheltering Arms signed an agreement with IRS and in partnership with the NTEU, which is their union. This center has been operating for a year now. We're very excited about this partnership. In my opinion, this is the future of child care. We have public monies here, we have federal monies, we have United Way dollars, we have union scholarship money. It's just the perfect meld of funding to make affordable quality child care, not just for IRS employees, but for the surrounding community as well.
The affordability of daycare would have been a big concern to me. Financially, I was not ready to take on that responsibility, and had not been for the environment that I worked for helping me with that certainly would have been the biggest hurdle that I would have had to have overcome.
One of the most important concerns about daycare for me is the accessibility. When I need to get off from work and take her, it only takes me a couple of minutes to get from the building here. I can stop in anytime that I want to and know what's going on and know how she's treated. And it's not like some of those daycare centers where they only want you to come in at certain times of the day and give them some advance notice so they can have things the way they want them.
Child care is part of a bigger societal issue. I think we're seeing a whole big movement toward what I'd call family support and family resources, that children are part of families, that they're part of communities, and that while we address child care, we also need to address children and families in their broader context.
It's everybody's business. It's not that mother looking for child care. It's not that child who's sick and needs a place to be. It's not the child who finishes school at 3 o'clock and wonders what he or she is going to do until 7 o'clock. It's everybody's business, because what happens to that mother, what happens to that sick child, what happens to that latchkey child is going to make a difference in how the state of Georgia develops.
Giving each child a good beginning, the promise and hope for a brighter future, is perhaps the greatest challenge we face as a people. There are no easy answers or simple solutions. As we look back to the early beginnings of child care in that boxcar mission on Marietta Street, how far have we come in answering the question, who's minding the children?